Hi bio students, my name is Maggie, and this is my dog. Some call her Bizarre, but I call her Posey the Science Dog.
Bill Nye the Science Guy.
You would think that with 79 million Americans infected with HPV, a sexually transmitted infection that can lead to genital warts and several types of cancers, there would be no question about whether or not it's a good idea to receive the HPV vaccine. However, a variety of exaggerated or false claims regarding the HPV vaccine, often spread by figures or groups with authority, have led the general public to believe that receiving the HPV vaccine can lead to detrimental health effects such as mental retardation and anaphylaxis. Myth number 1. HPV vaccination causes mental retardation.
Republican politician Michelle Bachmann briefly spoke against the distribution of the HPV vaccine amongst teenage females, suggesting that there were permanent negative effects caused by the vaccine. She provided an anecdote of a distressed mother who approached Bachmann to share that HPV vaccination has caused mental retardation for her daughter. Through broadcasting this anecdote on Today Tuesday show, the public is now convinced that treatment by HPV vaccination leads to mental retardation, though this claim is far from the truth.
As my other partner said, that is far from the truth. Posey the Science Dog has actually taught me a lot about this topic. She told me that Dr. O'Marion Burton, the president of the American Academy of Pediatrics, responded to Bachmann's statements by asserting that there is no scientific validity to any of these claims. In addition, 35 million HPV shots were already administered while maintaining an excellent safety record as verified by VAERS, the Vaccine Adverse Event Reporting System. Myth number 2. The HPV vaccine causes serious and adverse side effects, even death.
The HPV vaccination causes serious side effects, with the most adverse being death. Between June 2006 and March 2014, the Vaccine Adverse Event Reporting System, VAERS, of the Center for Disease Control and the Food and Drug Administration received 25,176 reports of the HPV vaccine causing adverse effects, including 85 deaths. With those numbers, there's got to be something wrong with the vaccine, right?
Yet again, that is false. Approximately 92.4% of the cases reported regarding adverse effects did not actually qualify as adverse, which are those that are life-threatening or result in death, permanent disability, abnormal conditions at birth, hospitalization, or prolonged administration. Further investigation into the 85 deaths that followed vaccination showed that there was absolutely no connection between the vaccination and the cause of death. Myth number 3. HPV vaccinations cause anaphylaxis.
The HPV vaccine causes anaphylaxis, a severe allergic reaction. This was based on a 2007 study done in Australia, where reportedly the incidence of anaphylaxis as a result of the HPV vaccine was much higher than the incidence rate of the meningitis C vaccine.
This myth was based on a 2007 study conducted in Australia, which found 8 cases of anaphylaxis when the HPV vaccine was administered in schools, with an incident rate of 2.6 per every 100,000 individuals. However, the conclusions of this study is unclear, and it is possible that the rate of anaphylaxis is higher in Australia than in other regions of the world. In the United States, 13 million doses of the HPV vaccine were administered in 2007, with only 15 reported cases of anaphylaxis. It is possible that patients had a hypersensitivity to an ingredient in the vaccine, as they would have had for another vaccine for another virus containing the same ingredient. The 3 HPV vaccines available are all monitored and licensed by the CDC and the FDA. Myth number 4. The HPV vaccine has so much aluminum that it's poisonous.
The HPV vaccine contains too much aluminum to be safe and is therefore toxic.
Aluminum has been used in small amounts in many vaccines safely for over 70 years. The amount of aluminum in the vaccine is monitored by the Food and Drug Administration, or the FDA. Aluminum works as an adjuvant, which is an added ingredient to a vaccine that helps cause a stronger immune system response in a patient. Therefore, aluminum acts as an adjuvant in the HPV vaccine, ensuring that it provokes a strong enough immune system response in the body. In safe amounts that are monitored again by the FDA, aluminum aids the HPV vaccine without causing any danger. I think that we can consider these 4 myths
Busted!